If you're over 65, there's something your doctor probably hasn't told you clearly enough. Some of the most commonly prescribed medications in the world can quietly do more harm than good as your body ages. Not immediately, not dramatically, but slowly, subtly, in ways that build up over time until one day you're dealing with confusion, falls, memory loss, or even serious complications that seem to come out of nowhere. And the surprising part is that many of these medications are still being handed out every day to older adults who trust that they are safe. In this video, I'm going to walk you through 3 medications I would personally never take after 65, and more importantly, why. This is not about fear. It is about understanding how your body changes with age and making smarter, safer decisions for your long-term health. As we get older, the body does not process medications the same way it did at 30 or 40. The liver slows down, the kidneys filter less efficiently, body fat increases while muscle mass decreases, which changes how drugs are stored and released.
Even the brain becomes more sensitive to certain chemicals. This means a dose that once felt normal can suddenly become too strong, too prolonged, or too risky. And yet many prescriptions are written using guidelines that were originally tested on younger populations. That mismatch is where problems begin. The first medication category I would avoid after 65 is long-term use of benzodiazepines. These are drugs commonly prescribed for anxiety, sleep problems, and sometimes even muscle relaxation. You might recognize names like diazepam, alprazolam, or lorazepam. On the surface, they seem helpful. They calm the nervous system, reduce anxiety quickly, and can help with sleep. But the problem is what they do to the aging brain over time. Benzodiazepines work by enhancing a neurotransmitter called GABA, which slows down brain activity. In younger people, this can create a temporary calming effect. In older adults, it often leads to excessive sedation, confusion, and impaired coordination. Studies have shown that long-term use is strongly associated with an increased risk of falls and fractures. And falls are not a minor issue after 65. A single fall can lead to hospitalization, loss of independence, or even life-threatening complications. Even more concerning is the link between benzodiazepines and cognitive decline. Regular use has been associated with memory problems and an increased risk of dementia. While researchers are still studying the exact relationship, the pattern is clear enough that many experts now recommend avoiding these drugs entirely in older adults unless absolutely necessary and for very short durations. There is also the issue of dependence. The longer someone takes benzodiazepines, the harder it becomes to stop. The brain adapts to their presence, and stopping suddenly can lead to withdrawal symptoms like anxiety, insomnia, and even seizures in severe cases. This creates a cycle where the medication that was meant to help becomes something the body feels it cannot function without. Safer alternatives often exist. For anxiety, therapies like cognitive behavioral therapy can be extremely effective. For sleep, improving sleep hygiene, addressing underlying issues, and sometimes using safer medications for short periods can make a big difference. The key is not to rely on a drug that alters brain chemistry in such a powerful and long-lasting way. The second medication I would avoid after 65 is diphenhydramine, which is commonly found in over-the-counter sleep aids and allergy medications. Many people know it as a harmless remedy that helps them fall asleep faster. It is widely available and does not require a prescription, which makes it feel safe. But in older adults, it can be surprisingly dangerous. Diphenhydramine is an antihistamine with strong anticholinergic properties. This means it blocks a neurotransmitter called acetylcholine, which plays a critical role in memory, attention, and overall brain function. As we age, acetylcholine levels naturally decline. Blocking it further can lead to confusion, dizziness, blurred vision, and even delirium. One of the biggest risks with diphenhydramine is its effect on mental clarity. Older adults who take it regularly may experience brain fog, forgetfulness, and difficulty concentrating. In some cases, it can trigger acute confusion that looks very similar to dementia. This is especially dangerous because it can be mistaken for a permanent condition when it is actually medication-related. It also increases the risk of falls. The sedative effect can linger into the next day, affecting balance and reaction time. Combine that with blurred vision and dizziness, and the chances of a fall rise significantly. As mentioned earlier, falls in older adults can have serious consequences. Another hidden issue is urinary retention. Diphenhydramine can make it harder to empty the bladder, which can lead to discomfort, infections, and complications, especially in men with prostate enlargement. Many people take these medications nightly without realizing the long-term impact. What starts as a simple solution for sleep can quietly interfere with brain health and physical stability. Better options for sleep include maintaining a consistent sleep schedule, limiting screen time before bed, managing stress, and addressing underlying conditions like sleep apnea. In some cases, a doctor may recommend safer alternatives, but the goal should always be to minimize reliance on sedating medications. The third medication I would avoid after 65 is certain non-steroidal anti-inflammatory drugs, often referred to as NSAIDs, when used regularly or long-term. These include medications like ibuprofen and naproxen. They are extremely common and very effective for pain relief, which is why so many people rely on them for arthritis, back pain, or general aches. The problem is that long-term use of NSAIDs carries significant risks, especially in older adults. One of the most serious is the increased risk of gastrointestinal bleeding. These medications can irritate the lining of the stomach and intestines, leading to ulcers and bleeding. In younger individuals, the body can often recover more easily. In older adults, this can become life-threatening. NSAIDs also affect kidney function. As kidney efficiency naturally declines with age, adding a medication that further stresses the kidneys can lead to acute kidney injury or worsen existing kidney disease. This is particularly risky for individuals who are also taking medications for blood pressure or heart conditions. There is also a cardiovascular risk. Some NSAIDs have been linked to an increased risk of heart attack and stroke, especially when used at higher doses or for extended periods. For someone over 65 who may already have underlying cardiovascular risk factors, this is a major concern. That does not mean these medications should never be used. In short-term situations and under medical supervision, they can be helpful, but using them daily for chronic pain without a clear plan is where the danger lies. Safer approaches to pain management often involve a combination of strategies. Physical therapy can strengthen muscles and improve joint function. Gentle exercise can reduce stiffness and improve mobility. Weight management can take pressure off joints. In some cases, topical treatments or alternative medications may be recommended that carry fewer systemic risks. What all three of these medication categories have in common is that they were not originally designed with the aging body in mind. They can still have a place in treatment, but only when used carefully, for the right reasons, and with full awareness of the risks. One of the most important steps you can take is to regularly review your medications with a healthcare professional. This includes prescriptions, over-the-counter drugs, and even supplements. Many older adults are taking multiple medications that interact with each other in ways that increase side effects. This is known as polypharmacy, and it is one of the leading causes of medication-related problems in older populations. Ask questions. Why am I taking this medication? Is it still necessary? Are there safer alternatives? What are the risks for someone my age? These conversations can lead to adjustments that significantly improve quality of life. It is also important to never stop a medication suddenly without guidance. Some drugs require gradual tapering to avoid withdrawal effects or other complications. The goal is not to eliminate medications blindly, but to use them wisely and only when the benefits clearly outweigh the risks. Aging is not about avoiding all medications. It is about understanding how your body changes and making choices that support long-term health, independence, and mental clarity. The right decisions today can prevent serious problems down the road. Let's go deeper, because understanding the why behind these risks is what actually helps you make better decisions, not just memorizing a list of medications to avoid. One of the biggest changes that happens after 65 is something most people never think about, and that is how drugs move through the body. This is called pharmacokinetics, and it includes how a drug is absorbed, distributed, metabolized, and eliminated. With age, Each of these steps becomes less predictable. Your stomach may absorb drugs differently. Your liver enzymes, which break down medications, become less efficient. Your kidneys, which filter waste and drugs out of your blood, slow down year after year. This means a medication that once stayed in your system for a few hours might now linger much longer. Instead of a gentle effect, it can build up, dose after dose, leading to toxicity without you even realizing it. This is especially true for medications that affect the brain, like sedatives or antihistamines, where even a small buildup can change how clearly you think or how steady you feel on your feet. There is also something called pharmacodynamics, which refers to how sensitive your body is to a drug's effects. And this changes too. As we age, the brain becomes more sensitive to medications that depress the central nervous system. So even if the dose is technically the same, the effect can be much stronger. That is why a sleeping pill that once made you slightly drowsy can suddenly leave you groggy, disoriented, or even confused the next day. Now here is something even more concerning. Many older adults are not just taking one medication. They are taking 5, 10, sometimes even more. Each one may be justified on its own, but when combined, the interactions can become dangerous. One drug may amplify the effects of another. Another may slow down how a different medication is cleared from the body. This creates a situation where side effects are no longer predictable. For example, imagine someone taking a benzodiazepine for sleep, an antihistamine for allergies, and an NSAID for pain. Each of these has its own risks, but together they can significantly increase sedation, impair coordination, irritate the stomach, and strain the kidneys all at once. This is how small, seemingly harmless decisions can add up to major health problems over time. Another factor that is often overlooked is hydration. As people age, the sense of thirst becomes less reliable. Many older adults are slightly dehydrated without realizing it. Dehydration can concentrate medications in the bloodstream, making them more potent. It can also worsen kidney function, which further slows drug clearance. This combination can turn a normal dose into something much more dangerous. Let's also talk about sleep, because this is one of the most common reasons people turn to medications like benzodiazepines or diphenhydramine. Sleep changes naturally with age. You may fall asleep earlier, wake up earlier, and experience lighter sleep overall. That does not necessarily mean something is wrong, but many people interpret these changes as a problem that needs to be fixed with medication. The issue is that sedative medications do not create natural sleep. They create a form of sedation that alters the brain's normal sleep architecture. This means you may spend less time in the deeper restorative stages of sleep. So even if you are technically asleep for 8 hours, you may wake up feeling unrefreshed. Over time, this can actually worsen fatigue and lead to increased reliance on the medication. There is also a psychological component. When someone believes they cannot sleep without a pill, it creates a dependency that goes beyond the physical effects of the drug. This makes it even harder to stop because now both the body and the mind are involved. Pain management is another area where people often feel stuck. Chronic pain is very real, and it can significantly impact quality of life. But relying heavily on NSAIDs without addressing the root cause can create a cycle where the pain is temporarily masked while the underlying issue continues to worsen. For example, joint pain may be related to muscle weakness, poor posture, or lack of movement. Using medication alone does not correct those issues. In fact, it may allow them to progress silently. This is why approaches like physical therapy, strength training, and targeted exercises can be so powerful. They do not just reduce pain in the moment, they improve function over time. There are also newer strategies for managing pain that focus on the nervous system itself. Techniques like mindfulness, relaxation training, and even certain forms of cognitive therapy can change how the brain processes pain signals. This does not mean the pain is imagined. It means the brain's interpretation of that pain can be influenced in ways that reduce suffering without relying solely on medication. Now let's talk about something that does not get enough attention, and that is how medications can affect independence. Many of the side effects we have discussed, like dizziness, confusion, and slowed reaction time, may seem minor at first, but they can have a huge impact on daily life. Imagine feeling slightly unsteady when you stand up. You may start to avoid certain activities. You might walk less, socialize less, or hesitate to leave the house. Over time, this can lead to muscle loss, isolation, and a decline in overall health. What started as a small side effect becomes a chain reaction that affects multiple aspects of life. Cognitive effects can be just as impactful. Even mild memory problems or difficulty concentrating can interfere with managing finances, taking medications correctly, or following medical advice. This increases the risk of mistakes, missed doses, or accidental overdoses. One of the most empowering things you can do is to become an active participant in your own healthcare. Do not assume that every prescription is meant to be permanent. Medicine is not static. Your needs change over time, and your treatment plan should change with them. There is a concept called deprescribing, which is the process of safely reducing or stopping medications that may no longer be necessary or beneficial. This is not about removing treatment. It is about refining it. Studies have shown that deprescribing, when done carefully, can improve quality of life, reduce side effects, and even lower the risk of hospitalization. If you are considering this, the first step is a simple one. Make a complete list of everything you take. Include prescriptions, over-the-counter medications, vitamins, and supplements. Then review that list with a healthcare professional who understands the unique needs of older adults. Ask which medications are essential, which ones could be reduced, and which ones might be doing more harm than good. It is also worth paying attention to how you feel on your medications. If something makes you feel foggy, dizzy, unusually tired, or just not like yourself, that matters. These are not minor inconveniences. They are signals from your body that something may need to be adjusted. Another important point is timing. Taking medications at the right time of day can sometimes reduce side effects. For example, a medication that causes drowsiness might be better taken in the evening, while one that increases alertness should be taken earlier. Small adjustments like this can make a big difference. Nutrition plays a role as well. Certain foods can interact with medications, either enhancing or reducing their effects. A balanced diet supports liver and kidney function, which in turn helps your body process medications more effectively. And finally, let's talk about prevention, because this is where the real power lies. The fewer medications you need, the lower your risk of side effects and interactions. This does not mean avoiding treatment when it is necessary. It means investing in habits that reduce the need for medication in the first place. Regular physical activity, even something as simple as daily walking, can improve heart health, joint function, and mental clarity. A diet rich in whole foods supports overall health and reduces inflammation. Good sleep habits improve energy and cognitive function. Social engagement supports mental health and reduces the risk of cognitive decline. All of these factors work together. They create a foundation that allows your body to function more efficiently, making you less reliant on medications that may carry risks. So when I say there are certain medications I would never take after 65, it is not about fear or avoidance. It is about awareness. It is about recognizing that what works at one stage of life may not be appropriate at another. And it is about making informed choices that protect your health, your independence, and your quality of life for years to come. Because at the end of the day, the goal is not just to live longer, it is to live better. There is one more layer to this conversation that most people never hear about, and it can completely change how you think about medications after 65. It is the difference between treating symptoms and protecting function. When you are younger, treating a symptom quickly often feels like the right move. You have a headache, you take something for it. You cannot sleep, you take something for that. You feel anxious, there is a pill for that too. And in many cases, short-term use makes sense. But as you get older, the priority shifts. It is no longer just about removing a symptom in the moment. It is about preserving how well your body and mind function over time. And here is where things get tricky. Some medications are very good at masking symptoms, but they quietly reduce function in other areas. You might sleep faster, but your brain becomes foggier. You might feel less pain, but your kidneys are under more stress. You might feel calmer, but your balance and coordination suffer. These trade-offs become much more significant after 65 because the margin for error is smaller. Think about balance for a second. Balance is not just about your legs. It is a complex system involving your brain, inner ear, vision, and muscles all working together. Medications that slow down the brain or affect nerve signaling can interfere with this system. Even a slight delay in reaction time can mean the difference between catching yourself and falling. And as mentioned earlier, one fall can change everything. Vision is another area that medications can quietly affect. Drugs with anticholinergic properties can cause blurred vision or difficulty focusing. That might not seem like a big deal at first, but it can make driving more dangerous, increase the risk of tripping, and reduce confidence in daily activities. Over time, this can lead to reduced independence, which then affects mental and emotional health. Let's also talk about something called the prescribing cascade. This happens when a medication causes a side effect that is mistaken for a new medical condition, leading to the prescription of another drug. That second drug may then cause its own side effects, leading to a third medication, and so on. For example, someone starts a medication that causes swelling in the legs. That swelling is then treated with a diuretic. The diuretic leads to dehydration or electrolyte imbalance, which causes dizziness. The dizziness is then treated with another medication. Before you know it, one initial prescription has turned into multiple medications, each adding its own risk. This is not rare. It happens more often than people realize, especially in older adults. And the problem is that each additional medication increases the complexity of the situation. It becomes harder to identify what is causing what, and the risk of interactions grows. Another important concept is resilience. When you are younger, your body can often compensate for stress. If a medication causes a mild issue, your system adjusts. After 65, that resilience is reduced. The body has a harder time bouncing back. So what might have been a minor side effect years ago can become a major problem now. This is especially true when it comes to the brain. The aging brain is more vulnerable to changes in chemistry. Medications that alter neurotransmitters can have stronger and more unpredictable effects. This is why drugs that affect mood, sleep, or anxiety need to be used with extra caution. There is also growing awareness about the long-term impact of certain medications on brain health. While research is still evolving, patterns are emerging that suggest minimizing exposure to drugs that impair cognitive function may help protect memory over time. This is not about eliminating all risk, but about reducing unnecessary exposure whenever possible. Now, here is something practical you can start doing immediately. Pay attention to patterns. If you notice that you feel more confused, more tired, or less steady after starting a medication, do not ignore it. Keep track of when the symptoms started and how they relate to your medication schedule. This kind of information is incredibly valuable when discussing changes with your doctor. Also consider simplifying your routine. The more complicated your medication schedule is, the higher the chance of errors. Missing doses, doubling doses, or taking medications at the wrong time can all increase risk. Using a pill organizer or setting reminders can help. But sometimes the best solution is to reduce the number of medications when it is safe to do so. Let's not forget the role of communication. Many people hesitate to question their prescriptions. They assume that if something was prescribed, it must be necessary. But medicine is not one size fits all. What is appropriate for one person may not be ideal for another, especially when age and overall health are considered. Having an open conversation with your healthcare provider can lead to better outcomes. You are not being difficult by asking questions. You are being responsible. A good provider will welcome that and work with you to find the safest and most effective approach. Caregivers also play a huge role here. If you are helping a parent or loved one manage their medications, your observations matter. You may notice changes that they do not recognize themselves. Bringing those observations to a healthcare professional can make a real difference. And finally, it is important to understand that reducing risk does not mean doing nothing. It means being intentional. It means choosing treatments that support your long-term health rather than just providing short-term relief. There are many cases where medications are absolutely necessary and life-saving. Blood pressure medications, certain heart medications, treatments for diabetes, and many others can significantly improve both lifespan and quality of life when used correctly. The goal is not to avoid medication altogether. The goal is to avoid the ones where the risks begin to outweigh the benefits, especially when safer alternatives exist. Your health after 65 is shaped by thousands of small decisions. What you eat, how you move, how you sleep, how you manage stress, and yes, what you take. Each choice adds up, and the more informed those choices are, the better your chances of staying independent, sharp, and active. So take this information as a starting point, not as a list of rules, but as a way to think differently about your health. Because the truth is, the most powerful tool you have is not a prescription. It is understanding. And if this opened your eyes even a little, share it with someone who might need to hear it. It could help them avoid a mistake that is far more common than people realize. If you want more videos like this, where complex medical topics are broken down into clear, practical advice you can actually use, make sure to subscribe and stay connected. Your future health is being shaped by what you learn today, and the more you understand, the better decisions you can make for years to come.